In today's lesson, we are learning about the radioisotope Technetium-99m. Before learning about Technetium-99m, let's start with the basics of isotopes. Isotopes are atoms in which vary with two or more forms as the nucleus contains the same number of protons but differ of amount of neutrons in their nuclei. All elements have an atomic number and mass number. The atomic number of an atom is equal to the number of protons it contains. The isotope elements differ between each other according to their mass number, which represents the equal number of protons plus neutrons in the nuclei of the element. Most isotopes are considered to be stable, yet some aren't as they decay and emit three types of high radiation energy, such as alpha particles, beta particles, and gamma rays. These are known as radioactive isotopes or radioisotopes preferably. Radioisotopes decay as mentioned before, and this is called their half-life. This is the time it takes for half of the element to break down, which all differentiate the time they take to break down. What is Technetium-99m? In the area of medicine, Technetium-99m is the most commonly used isotope as it's used in 80% of procedures worldwide. Technetium-99m is a diagnostic medicine in which undertakes a radioactive process where it emits gamma-ray radiation. The half-life of Technetium-99m is 6 hours. Being a popular isotope, getting Technetium-99m is a significant issue as the supplier lives a great distance away. Having the half-life of 6 hours, by the time Technetium-99m has arrived at the hospital, it would have almost been broken down. To solve this problem, doctors use a different isotope called molybdenum-99, as it has a half-life of almost 3 days. This breaking down process of this radioisotope forms Technetium-99m, which doctors then separate Technetium-99m from molybdenum-99 from the container. Radiation produced from Technetium-99m. Technetium-99m emits readily detectable gamma-ray radiation. When Technetium-99m is being used as a radioactive tracer, which traces the path that the radioisotope follows from reactant to products, gamma cameras are medical utensils used to detect areas of the body. Gamma-ray radiation allows scanning procedures which collect data rapidly but keep total patient radiation exposure low. These identical characteristics make the isotope appropriate for diagnostic procedures. How Technetium-99m is used in medicine. In medical procedures, Technetium-99m is used in diagnosing patients. Technetium-99m is a tracer used to capture images inside the body and diagnose conditions in the heart, spleen, kidney, lungs, bone, and liver. Technetium-99m is also used in blood flow studies. The Technetium-99m becomes attracted when it finds an area in the body with faster growth, and when the substance focuses on an area, gamma rays are visible on the scan, locating a possible cancerous or tumorous growth. Technetium-99m is generally injected through the vein and may be attained orally. Benefits of using Technetium-99m. Having a short half-life of 6 hours means that the Technetium-99m decays rapidly in the body and has minor harm to the patient. Having a low energy emission level is just enough for gamma cameras to detect areas of the body, yet minimizing the harm of the patient. As there are more than one form of Technetium-99m, it means it can travel to many organs throughout the body. Lastly, it examines a metabolic process without significant harm to the patient, and Technetium-99m is used 80% worldwide. Problems of using Technetium-99m. Consuming or injecting medicine into the body comes with side effects, including Technetium-99m. Unwanted side effects may occur, however, a few may require medical assistance. A nuclear reactor is required for the making of this isotope. A Technetium-99m generator is required for production. The making of the product is highly expensive, and radioactive waste is produced during the production process of Technetium-99m. Justification. How do the benefits of using Technetium-99m outweigh the problems associated? The benefits of Technetium-99m significantly outweigh the problems, as problems of using Technetium-99m can be managed easily as the harm is minor to the patient. Also, Technetium-99m was discovered in 1937 and has been used exceedingly well as its 6-hour half-life is the largest benefit, incorporating the health and safety of patients worldwide.